Brilliant. Welcome to this session, everybody. Today we're going to be talking about the future of GP and getting your thoughts on what you'd like to see in the future. As I introduced myself before, my name's Emma. I'm a F1 doctor in Kettering currently at the moment. And I've been involved in the RCGP for a long time. We're also joined today by Lucia, who I met at NHS England in Improvement in the Primary Care Directorate, but also does a lot of work in women speakers in healthcare, which they aim for balanced gender representation for all speakers and panelists at events like today. And she's an academic clinical fellow at St. George's. Gary is also here today. He'll be speaking after Lucia, and he's the RCGP's Vice Chair for External Affairs. He's a GP partner at the Octagon Medical Super Practice in Peterborough, the Vice Chair for the Cambridgeshire and Peterborough Sustainability and Transformation Partnership Board and the Greater Peterborough Network. If any of those things don't make any sense, feel free to ask us during the session as to what these various roles mean and how you guys can get involved and be these people in the future. I'll hand over to Lucia now.
That's great. Thanks so much, Emma. So hello, everyone. My name's Lucia Magee. As Emma said, I'm an academic GP registrar in Southwest London, and I still work with the primary care team at NHS England and run the Women Speakers in Healthcare Network. So this morning during our session, we're hoping to show you about the joy of general practice and what it can offer, as well as how the future of general practice looks innovative and rewarding, both for healthcare staff and for patients. So to kick off with, we would love to hear from you. A key part of this session design was hearing from you as the next generation of future GPs, and we'll be using your thoughts and feedback going forward. So I'd like to invite you all now to log on to menti.com, and you can do that either with the QR code, which you can see there just in the top right corner, or you can log on to menti.com and you can enter the code 22533167. So I'm just going to give you all a moment to log in there, and then we're going to start going through these questions. Okay, so hopefully you're all managing to log in to menti.com, and I'll just get started. Oh, brilliant. We've got some answers coming up here. So the question is, what changes have you noticed or heard about in general practice working during the pandemic? So yeah, we've got lots of comments there about telephone, remote consultations. I can also see just at the bottom of the screen there, yeah, delays in routine services for some patients, lots of flexibility and reactivity, remote working from home. Indeed, some patients have been presenting with problems a bit later. And absolutely, consultations are certainly now moving more to telephone conferencing and remote conferencing consultations. That's brilliant. So that's fantastic. Thanks so much for sharing your thoughts about what you've seen. Okay, let's move on. So in your opinion, what impact have these changes had on patient experiences, either towards the negative or the positive, and on the GP and the workforce experience? So I'll just let you all vote, and we'll sort of watch the scales kind of move there. Okay, looks like it's still, looks like we're starting to kind of reach a middle point along both at the moment, so then they're not too far apart. So yeah, we can see that actually there's probably more nuance to this question, isn't there? And actually from both patients and GPs, there's been both positives and perhaps negatives of actually what's happened, and we'll maybe talk through some of those experiences and what's been happening. Great. Okay, so just now on to our final question here. So what differences have these changes made to your impression of GP as a career choice? So just interested to see how you've watched these changes and how that might have impacted on your views of the impression of GP. Okay, so we're in the 3.1 area at the moment. So we're hovering hopefully tending towards the more attractive there. That's brilliant. That's great. So thank you for sharing your thoughts with us, everyone. And I'm hoping that actually over the rest of the session, we're really going to be able to demonstrate to you why GP is a brilliant choice. So let's just move over there to the next slide. Okay. So yeah, that's brilliant. So what does GP look like in 2021? So from the patient perspective, your interactions will predominantly have been remote via telephone or video consultation. Perhaps your practice is using the Ask My GP messaging service and it's triaging appointments through messages. Many more patients now are likely to be using their phones to text photos, receive links with information. Medication requests can also be electronic. And from the clinician perspective, we've had to rapidly upskill, use digital technology and adapt to new ways of working. We've had to train ourselves to pick up new clues to understand the patient context, as well as be mindful of those who don't always have access to digital means of communication. And we've had to support our patients and their families through the far-reaching implications of the disease and the lockdown, from physical health issues, exacerbated mental health problems, bereavement, strained relationships, and economic hardships. We'll just move over to the next slide now. Thank you. However, this year, we've seen general practice truly rise to the challenges that it has faced, and there is so much to celebrate what has been achieved. This slide is just a snapshot, and we have seen general practice support our most vulnerable and shielded patients. We've risen to the challenges alongside others of delivering the vaccination programme, and we've worked flexibly and we've adapted to do this. So we've seen vaccination centres in mosques and temples, mobile units, the vaxi taxis, and more. So there's so much to celebrate in general practice, and I'm just, in the interest of time, just gonna keep going because I don't want to go on to Gary's time a bit too much. So all in all, we've seen some amazing things about what general practice has achieved. So given what we now know, what can we learn from the last few months, and what does the future of general practice look like? So we know that general practice is facing challenges, including increasing life expectancy and comorbidity. And we know from the Marmot Review 10 Years On report that the health gap has been growing between wealthy and deprived areas. However, despite all of these challenges, general practice has some really promising opportunities. These include the expansion of our workforce to have additional roles, so opportunities for social prescribers and pharmacy technicians joining our team. We've seen the promotion of flexible working, including the encouragement of shared parental leave. And in the future, we'll be using digital technology to deliver more proactive and preventative care. So for example, monitoring patients' conditions remotely through home testing and wearables. The other thing that's on the horizon is genomics. So the wide-scale use of genomics in general practice will enable patient care to be individually tailored. So genomic medicine involves combining and analysing information about our genome with other clinical and diagnostic information. And this allows patterns to be identified that can help determine our individual risk of developing disease, as well as earlier detection of illness. The other thing is that GP networks will be able to consistently take a proactive population health-based approach rather than reactively struggling to manage demand. And GPs will have a comprehensive understanding of the health needs of the populations they serve. and be able to work to improve community level health and tackle health inequalities. So the Royal College of General Practitioners released the Fit for the Future report, I think it was 2019, and I'd really recommend you all to go and have a look at that after this session. And what I'm going to do now is hand over to Gary, who'll take us through some of those key highlights.
Morning everybody, and thank you for that. We're going to have a quick whiz through the next few slides. As Lucia has just said, if you Google Fit for the Future RCGP, that'll give you the whole document talking about our future vision for 2030. As said, I'm Vice Chair GP, and I have to say that this is going to be an unashamed advert for a speciality that I came to late. I originally trained as a dentist, then as a surgeon, but I found my professional home in general practice rather by surprise to myself, as much as anyone else I was working with. So the future of general practice, it's going to be about us working with a huge multidisciplinary team, which we'll touch on in a minute, hopefully getting longer time with our patients to acknowledge the complexity of the care that we're providing these days. We're going to need better technology because that will help us with both communicating with patients, but also allowing them to have access to their records, as well as the GP and the wider health team. And as Lucia's just said, touching on genomics. So if we can move on to the next slide, please. I think probably the biggest change we've seen recently has been evolution of the GP team. When I started 15 years ago, it was just doctors and nurses working in a practice. We now have pharmacists, physicians associates, physiotherapists, paramedics, social prescribers, benefits advisors, all of the things that we know affect people's lives and impact on their health and well-being. And it's recognition that there's a whole pool of talent out there that we needed to bring into our teams. But it's also made my job more enjoyable because I know we can serve the broader needs of my patients and my population. In terms of emerging roles, we've seen other people coming into our teams around dietetics, health coaches, care navigators, occupational therapists, and social prescribers, which again, it's really important to recognise that an important part of our team is our business and our administration team. And they're the people that are running the business side of the practice. So we've got IT specialists, finance specialists, HR specialists, practice managers, finance officers and accountants, all working within our broader team to make sure that our business is sustainable, as well as the clinical care that we provide. Next slide, please. So the future of general practice and technology, we've seen a massive leap in the last 12 months over the pandemic. Just simple things like provision of webcams, software so that we can communicate by text and by video with patients, laptops so that we can work remotely, all things that you'd think had been in practice for a long time, but weren't part of the core technologies we were using. We're using the telephone a lot more. It's been sat on our desks for the last 30 years, but it hasn't been a big part of general practice. But working remotely has had a huge amount of benefits for patients, as much as they don't have to spend the time coming into the practice unless they need a face-to-face examination. In the role of the pandemic, it's helped us to keep people safe from transmission and infection with COVID, but it's also meant that those patients we do need to see face-to-face, we can bring into the practice and spend more time with. Wearable technologies are important as well, remote monitoring, pulse oximetry, all the sorts of things that you've seen in the media recently about the way we're changing our way we work. Okay, next slide, please. I think probably one of the other really important things to say is that general practice is no longer a speciality sitting in glorious isolation. We know, and we're taught at medical school about the biopsychosocial model of care, and that's what us GPs work to. We understand the importance of the context of people's family lives, their history, their communities, their employment, their housing opportunities, and their financial situations, and the impact that has. They're not merely a collection of symptoms, they're the people that live with them and their support services as well. It's really important that within a system we can share data, so electronic patient records is becoming increasingly important. The ability to review patients' multidisciplinary teams remotely is really important, and the fact that patients only have to tell their story once within the health and care system is really important, because that's the thing patients tell us irritates them most. Relationships with our patients is the raison d'etre of general practice, continuity of care, continuity of information, and continuity across decades, providing care within a community that you're a part of and you're trusted by and you're important to, is what inspires a lot of us GPs to carry on doing the work that we do. So if I can just move on to the next slide, please. This is the last one from me. General practice is a profession that gives you so many opportunities outside just the straight clinical medicine. There's opportunities in health and system leadership. I spend a day and a half working at regional level and then a day and a half working at national level, which is a real privilege to see the challenges we're facing through different lenses. There's education and training of the next generation, academic research and innovation, technology utilisation, a whole host of different things that you could build into your portfolio once you've qualified as a GP. I'm acutely aware of time. I was told to finish at 10:02 so that we could move into the breakout groups, because it's equally as important that we hear from you guys. So if I can hand back to Emma, I think is going to tell us about the breakout groups, but this is a quote that I really love. The best way to predict your future is to create it. And this is where that creation starts. You've got an opportunity today to talk to people that do have the influence to see which direction the profession's going to go in. So please feel free to join in and share your thoughts with us in the breakout groups. Thank you.
Thanks very much, Lucia and Gary. That was a really good overview of some of the challenges and some of the opportunities that we have. And I think it is a really exciting time. And certainly during my time at the RCGP, I've found huge opportunity to contribute and to voice what I'd like the future to look like. And today, this is your opportunity to contribute to that, but also to ask questions. I know lots of people are very anxious about digital working and about how things are changing. But there's also a huge opportunity with that. And so we're going to break out into the rooms. And what we want to discuss is, how do you want GP to look like when you become a GP? And if you have questions, if you have any anxieties, feel free to voice them, feel free to challenge us, feel free to ask lots and lots of questions. And then we'll come back and share the different breakout rooms and the different thoughts and reflections we've had. But please ask the questions, please discuss and share your thoughts. Thank you very much. We'll break out into the rooms. So my thoughts from our group is, we had a bit of discussion about the role of technology particularly, and the role in managing chronic conditions, and thoughts of how we felt as clinicians with face-to-face appointments versus virtual appointments, and a little bit of discussion about how we can have some effective consultations and actually how we cannot. I made a reflection about how we need to improve our training on this, and that starts at all levels. We also spoke a little about how the workload changes, that triaging via e-consultations and equivalents is different, and actually about how the working week is very different and will change throughout everybody's careers. We also had a little chat about how you can specialize in different things, and how GP is really flexible, and actually you can see more patients of a certain type if you have an interest in it. You can do more formal qualifications, you can run community clinics, and actually all of those are options, and the flexibility is huge, and it's very much about individual practices and speaking with your practice and what their particular model is. So I would encourage you all to go out and have a look at as many different models as you can, and ask as many different questions as you can, because it's all very different depending where you look. Lucia, did you have any thoughts from your session?
Yeah, so I'm just going to share some top 3 that we discussed. So the first one was discussing the importance of flexibility. So us as future GPs, the future GPs that we were talking to were saying, actually, I want to be able to bring in my patients that need more time, but actually for some of our patients and our GPs, actually for some things, doing it over the phone and remotely can actually be really convenient and have a lot of benefit. But we want to avoid transactional analysis, and we want to really have a flexible approach to giving the best to our patients. We talked about the importance importance of social advocacy and population health management, and how as GPs we want to be involved in that and make sure we're looking after our populations. And then the kind of third and final one, which I loved, was we need to continue to be trailblazers as GPs. And really, you know, we talked about how we were some of the first to come on to e-consult and using digital technology for various things, and actually let's continue to be those trailblazers going forward.
Thanks so much, Lucia. And Gary, did you have any thoughts from your group?
Yeah, thanks, Emma. So again, if we group them together, we talked about the benefits of flexibilities, both in terms of patients and respecting their time and their ability to access in different ways, but also flexibilities for the workforce and different roles that people could take on. We talked about how technology might allow for longer consultation times for those patients that you want to see face to face, and it's really important to highlight groups that are struggling with these new technologies or new tools, and which ones are getting benefits from them as well. And we also talked about inequalities and making sure that all of these new tools that have come into general practice don't lead to worse inequalities. And then really we just highlighted that anybody who's been doing their general practice placement or been F1 in general practice through the pandemic has seen a very skewed view of general practice. It's been quite isolating because people haven't sort of mixed together as a team as much as normal. So it's just giving reassurance that general practice is a team sport. One of the great joys of general practice is working with a whole host of health and care professionals to look after your patients. And just as we were going to get cut off, it was just to remind people that the breadth of opportunity that getting a GP qualification can give you in terms of your future working life, that bring that all together is the massive advantage of a career in general practice. Thanks, Emma.
Brilliant, thank you. And I think that was really interesting is we all had some very similar and also some quite diverse thoughts in those different groups. And I'd encourage you all to continue these discussions throughout the day and in other mediums, whether that's your practices, placements, rotations, or just reaching out to any of us via Twitter or any other medium you fancy. Just at the end of this session, we're just putting up your describing the future of general practice in 3 words. I think most of you filled this in before. It's the last Mentimeter question. And I think what's really exciting about this is you guys all think it's exciting and innovative. And a lot of you have got this discussion about technology, and that's a really relevant discussion at the moment, and one that we will share your thoughts on from this session and from the other sessions of today in contributing to how you guys want it to look. And I want you to feel really empowered, because what you say will be listened to and will continue to be listened to, and you really can shape the future of general practice, and you can make it look like the career you want it to be. That's the end of this session. I hope you all have a brilliant rest of your day, and there's lots of other opportunities to get involved. Check out things on Twitter. The RCGP GP annual conference is coming later in the year. There is lots of resources on the website, and we'll send out some resources after the conference. So please keep in touch with us, keep asking questions, and keep exploring the career option. Thank you very much, Lucia and Gary, for your contributions. It's brilliant to see you and to chat.
Thanks so much, Emma.
Thanks, everybody.